this new strain coming out of Brazil is likely more contagious, similar to the new strain that we discovered in the United Kingdom and in South Africa. And when these things are more contagious but not more severe, it's actually worse from a public health standpoint because more people are going to get it, which means ultimately there'll be more deaths. Whereas if the disease variant was a bit more severe, then those people would be more easily identified, taken care of in terms of quarantine, and then less people would be likely to die. But as I mentioned before, the good news is we are seeing a drop in cases. We are also seeing a really good amount of data that says the immunity from our native-borne infection is going to be long-lasting. We now have data that shows people that were infected have significant antibodies 6 months out. So this hopefully will keep growing and growing and growing. Moderna came out and said that they anticipate their vaccine will be good at least 1 year. My personal opinion, I think these vaccines may be good for 5 to 10 years. So that would be really, really good news. Moderna also came out in an announcement, this hasn't been published yet, it's been submitted for publication, that their vaccine in Petri dishes or in vitro is effective against both the UK and the South African variants. We know Pfizer has already published that data, so that's also good news that the vaccines will work against the variants. Yes, and we think potentially there may be another new strain that is in California in and of itself. So the places that have high rate of spread, they're more likely to have mutations. We call these variations of interest or mutations of interest because they have significant enough changes that could change the survivability of this virus. So we need to really get these case numbers down so we don't allow this thing to mutate as much, because the more case numbers there are, the more mutability there is, and the higher the likelihood that this thing could get around some of our prevention measures, including the vaccines. But so far, knock on wood, so good. Our vaccines have been shown to be robust against all the strains. Hopefully it will continue to be so against the Brazilian and maybe the California strain that is as yet not yet identified.